Oh, hi. I was muted. Let's try all that again. Randy Lober, you're here to talk about coverage for one here today. It's that kind of Wednesday here today. Holiday party here at Action Benefits. That's why I am dressed in my holiday attire here this morning. Here to talk to you today about coverage for one and show you some of the new features it's gotten here throughout AEP and OEP. Joined today by Renee Taval, one of our account managers, maybe even your account manager from the individual team. Renee, I want to give you a chance to say hi before we get started.
Hi, Randy. Thanks for having me this morning. And thank you for everyone who's joining us on this webinar. Hope you had a great AEP season, OEP season, and we are here to help. So please don't hesitate to reach out to our individual team with any questions you might have. We are happy to help you out and answer those questions for you.
Thank you, Renee. Thanks for being here and for sharing your expertise throughout today's session here as well. So let's go ahead and get started. Let's talk a bit about the history lesson of coverage for one, if you're not familiar, and talk about what brings us to offering coverage for one in its current state here today. In the before times, along pre-ACA, in fact, coverage for one first existed as a individual enrollment platform that was exclusive for Blue Cross before even the marketplace was a thing. And you could find and enroll your Blue Cross, Blue Shield, and Blue Care network clients into an individual plan, then called a My Blue plan of their choice. Coverage for one went dormant for a while as Blue Cross made a business decision to bring their enrollments back in house. But now that we are back in the individual business game and the Medicare game, we have brought coverage for one back and juiced it up with a bunch of new features that go beyond just marketplace or beyond off marketplace enrollment rather. Now you're going to see marketplace enrollments and even Medicare quoting enrollments here as well. That's a lot of stuff for one platform to do. So we are not going to talk about Medicare here today. In fact, the email that got you here today probably just talked all about marketplace and off-marketplace business. So the focus of today is our under 65 business and what you can do with and for your clients there. But we do have other sessions built for your Medicare business here as well. Let's talk first about coverage for one, and let's talk about that off-marketplace quoting and how that works. Should point out that you, as an agent, get a personalized URL when you partner with Action Benefits. That personalized URL, in this case for me, is demoagent.coverageforone.com, but yours might be sgolding.coverageforone.com or gmizarindino.coverageforone.com or whatever your first initial last name or any other combination of your URL might be. When your users choose to go there and you distribute that link to them via email or otherwise, they see a page that looks exactly like this. They'll know that you are presenting the plans here, even though you have the kind of the coverage form branding here. So it's co-branded with you. It'll be your picture here or whatever picture you like. Could be a logo, could be your headshot. Probably not the picture of the camel here that our tech team has preloaded, unless you're a camel person. I don't know. Well, whatever you like. Your clients will also see your name, your address, your phone number, fax, and email as appropriate to your agency here as well, so they know exactly who to call when they have questions about coverage, if they have questions about coverage. We'll show you a little bit about what your clients see here first before we go over to the agent side here as well. Let's get a quote and talk a little bit about these enrollment periods. You, of course, can choose open enrollment because it is open enrollment season. You can choose to enroll because you have an SEP. You can look for adult-only vision or dental coverage if they are appropriate for those, and those can be sold year-round. Renee, I do know you had a quick note about OEP that we should mention for our folks here.
Yes, just as a note, the last day to enroll for a 1/1/2024 effective date for the under 65 medical plans is this Friday. So all the applications that are sent to Action Benefits need to be submitted by 3 p.m. And that also applies with coverage for one. It will stop accepting the 1/1 apps at 3 p.m. on this Friday, the 15th. After that, the agents have the opportunity to enroll through their portal and process the application themselves.
So to be clear, that's only for off-marketplace applications. Our
Correct.
marketplace connection will accept those all the way up through midnight for the 15th. But good clarification there, Renee. Um, Speaking of open enrollment, let's talk a little bit about what that looks like. If I were to apply here, it tells you what the effective date is if you apply within this window. So we'll go ahead and walk through what your clients see as they would go forward here. Going to ask them a bit about themselves. In this case, we'll have sample client, sample, and we'll use my email address for stuff in the background here. I will say I'm a male because that is true here today, and we'll put my birth date in. You don't have to remember that, but you can if you want to send me birthday cards later. That's entirely up to you. I'm not going to hold it against you either way. And then your tobacco use. This person is not a tobacco user here today. They do have the option to add spouses or dependents here as well. For simplicity's sake of today's demonstration, we will just keep this a single contract. Next thing that's going to ask them is whether they're Medicare eligible. If they click yes, they will be directed to you to talk with them about their Medicare options. But if they click no, as they likely are not Medicare eligible here in OEP, we'll just click continue. And then they'll get a subsidy notice here where they have the opportunity to check for subsidy eligibilities, whether it's a premium tax credit or a cost sharing reduction. And here's a really neat feature, right? Because right here is some decision support on whether they want to go directly to the marketplace or whether they want to stay here off market, which is a little simpler of an enrollment experience. As I'm sure you know, there's no income tax verification and all that kind of stuff that goes along with this. So there's just one person on this tax return. And because I want to show you only the off marketplace version first, because it's fairly quick, we're going to make their income obscenely high for just a moment and calculate the subsidy. When we do that, it'll tell you right away, and this, by the way, hooks up to our EDE pathway, which we'll show you in a moment. It tells you that it is not, it's likely this person is not subsidy eligible. So they have the option still to go to the marketplace if they like, or they can just say no and stay here within Coverage for One off-market experience. Because we're not eligible for subsidies, or this sample person is not eligible for subsidies, we'll say no. And then we are brought right here to the medical plans selection, where we can kind of quote a few plans we might like, or your consumer might like. Because we're in the consumer experience, I'm going to talk as though I am the consumer here. There's a few things they should point out. First of all, if they want to see medical plan comparison sheets side by side for all these plans, they could simply click right here. When they get to medical, dental, and vision, they can also print quote sheets directly from there. You and they also have the option to filter plans. Maybe you only want to see HMOs, and maybe you only want to see bronze HMOs at that, but you do want to put BCN and Priority Health next to each other, or maybe your clients do, to see what could work for them. They can also set a maximum premium range for them here as well. As I filter down to that, I can go ahead and look at a few plans. I see my deductibles, out-of-pocket maxes, co-insurance rates, and my premium here per month. Remember, we're looking off-market here, so there's no subsidy applied or no subsidy estimate here. Benefits, so SBCs for each plan, as well as coverage details, prescriptions, a link to the formulary, and a link to the Find a Doctor tool for the relevant carrier are all here as well to help with that shopping experience. Amy, that is an excellent question. So for off-market, it will show you either or both Blue Cross Blue Shield, Blue Care Network, and Priority Health. If you don't have appointments with both of those carriers in this case, it will only show the carrier you're appointed with. We'll talk a little bit about on-market experience in a little bit moment, because the rules there are a little different. But if they're only off market, it's going to only show them what you offer. Taking a look at these, I want to show you how plan comparisons work and how easy that goes. Maybe I want to compare my Priority Value Bronze Southeast Michigan Network and the Blue Cross Local HMO Bronze Extra. So fairly apples to apples, putting two narrow networks close to each other. All I need to do is click on Compare Selected Plans. It's going to put those side by side here, show you deductibles, show you out-of-pocket maxes, and your monthly premium. If you'd like to print that comparison either email that or share a paper copy with your client, you are able to generate a PDF here with the print the comparison button. You can also remove plans from the quote here just as easily, and your clients can as well. So we'll click close from there. Say after looking at that, your client is really interested in that My Priority Value Bronze Southeast Michigan network. They're all about saving a few premium dollars with that narrow network. We'll go ahead and click select. So once I've selected a medical plan, now it's time to think about dental and vision. So because this demo account that I'm with is appointed with both Blue Cross and Priority, I'm going to see Blue Dental and my Priority Delta Dental here. And remember, of course, that you can kind of pick and choose what you go with here. If they want Delta Dental, you can go with that. If you want to go with Blue Dental, you have that option here as well. And you do have the option where Blue allows you to bundle that with vision coverage here as well. And you again see your deductibles, your plan details, provider surge, and everything else here as well. Comparing plans works exactly the same. To make it easy for this person, we're going to go with the Blue Dental EPO 80/50/50 and wrap in the vision coverage for $25.17 a month. And here I have the opportunity, and your consumer has the opportunity to review their selections. So they'll see what they're looking at here. They see that they might have a variety of carriers here. If they don't like what they see, or they later talk to you by using your link up here, your phone or your email up here, they have the opportunity to change plans here on this quote. But if they like what they see, they are able to apply and go forward from there. From here, this is the actual application piece. I'm going to make up a dummy SSN here. They are a U.S. citizen here in this case. We'll give them a primary phone number here as well. It's going to autofill the action benefits address. I don't think anyone lives here, but we'll see. And from there, they're moving forward. It's going to ask them whether they had previous coverage. Blue Cross does have some different continuous coverage rules to be aware of here. So if we said yes, they'd be asked for the enrollee ID number. If we said no, then we wouldn't. You answer your ethnicity questions here as well. So if this person is white but not of Hispanic origin, we'll ask for an income estimate here, as well as the premium. Well, actually, if we want to keep it consistent, they're greater than $90,000 in this case, and the subscriber will pay the premium. Because I chose an HMO, it will prompt me to select a PCP if I so choose. You don't need the PCP here right away, so it's a good idea. Remember, each carrier handles an absence of a PCP in different ways. Actually, Renee, are you able to share a little bit about that? How do, if I don't have the PCP right away for my client, how do Priority and Blue Care Network assign those, just as a refresher?
The member can always contact the carrier to let them know if they have a specific PCP they want to elect, and excuse me, to go ahead and to provide that information to the carrier to get that information updated.
Thank you. And they can also use their member portal to do so as well. So I'll make up a, actually, I won't fill out anything there because it does ask you to fill other things in if there's any other field filled out here. And then I'm off to the review phase, making sure my name is right, birth date is right, residential address, billing address are all the same. It'll show us what plan your consumer is opted into, and then ask them to sign. Here is probably one of the only confusing parts about the process, is that it doesn't, when it asks you to sign, it asks you to type the full name twice. So sample, then sample here in this case. It's not sample, it's sample. They'll choose today's date as the date they're applying. They cannot purchase yet until they view terms and conditions. So these are all those disclaimers that they must view before they enroll. And then they're off to purchasing coverage. So they get a thank you message for choosing Coverage for One. They get a prompt to ask you if they have any questions about that. And the application has been transmitted to our office to process and make sure coverage is stood up for the carriers. So Renee, I want to check in with you real quick. Anything to add around the consumer experience or anything else our folks should know about off-market applications before we show the agent dashboard here?
No, just that once you complete the process, our team will receive the Excel template with all the information, and then we will go ahead and get that processed with the carrier and get that application completed for the agent. So that's kind of how our process works. Randy, I want to just go back a couple sort of screens in regards to the comparison guide, like the quote. We do get a lot of requests from agents about how can they get a quote to show a variety of the off-marketplace plans through Coverage for One. That comparison guide is a really great tool. You can show a variety of plans. You can also, especially with that filter, you can even show the dental and the vision because the member might not be talking about dental and vision at the time, but you can have that there and the rates and the plan are all ready to kind of show the member in case they decide, you know what, I do want to add dental and vision on, and all the information is right there in that quote.
Yeah, a great addition there, right? So it kind of does the upsell for you, or at least presents the opportunity for the upsell for you. Absolutely. So that was the consumer pathway, fairly short, fairly painless. In under 6 or 7 minutes or so, we got through that enrollment, and it's just that easy for your consumers as well, as long as, of course, they know what plan they're looking for. I want to show you the agent dashboard here as well. So when you go to your URL, whatever that happens to be, you'll also see this agent login button. You'll have a credentials that you've created here. So this email address will be your email address on file. Your password will be one you create, and our individual team can help you get your invitation email for Coverage for One in case you might have missed it when it went out in the summer. But whatever you do, you'll go ahead and enter those credentials and then click submit and be brought to your agent dashboard. Few things to show you over here. Starting with the navigation bar, of course, there's your home screen. It'll always bring you back to this dashboard. If you want to share your link and you want to share it on Facebook, you want to put it on a post right away, or you want to put it in your email signatures or otherwise, you can always copy it here and have the option to change your password and log out of the portal here as well. You'll see any notifications that we think are important for you to see displayed for you right here. You'll see the countdown till OEP ends or till AEP ends if you're working in the Medicare market. But down here is some pretty powerful information here as well. You'll see quotes that will be working off marketplace. You'll see any submissions that have been made to our office here as well, your enrollments here to date, and your carrier mix over here for business that you submitted through the platform or that your consumers have submitted through the platform here. Some other things we should point out here is that sample, the submission we just did does show up here in my submission list here at 1213. If I'm interested, I can see which medical product they bought by hovering over here, or which dental or vision product they bought with the MDV. So I have a good idea of where my people are going. I also can have the option here up in the quoting tab. I can get more info about that consumer. I can choose to enroll that person or send them a nudge email to continue enrolling by themselves. I have the opportunity to see whether me as the agent started that quote or the consumer did, so I can decide whether I want to nudge them, what the quote date was and what the effective date was, and if they've selected a product, that will show up over here as well. So that's the dashboard in a nutshell. Down here, I do have some more options. Again, more info. I can send an email straight to sample here as well and learn and prompt them along here to the process or give them maybe some reminders. But that's the dashboard in a nutshell. It gives you a lot of insight into what you've done off market here as you're getting ready to work through this OEP and any SEPs your clients might be eligible for going forward. So Renee, anything else to add about the dashboard real quick before we jump into the on-market portion of our training here today?
Not so much about the dashboard, Randy, but we always like to remind agents if you have a technical issue trying to log into your Coverage for One URL, anything like that, please reach out to your account manager. We are happy to help, and we can create a ticket with IT to find out what's going on. we have ways of researching that to help you out. Also, if you update your phone number, if you need to update, any of your address, any information about your agency, please reach out again to one of your account managers and let us know. We can get that updated on our back end too, so that way when your members are looking at your coverage for one, all your contact information is up to date, it is correct, and we can get that updated right away once you send that in.
Yeah, absolutely. Nothing worse than giving your clients a bad phone number or a bad email address. Cool. Thank you. So let's go ahead and talk a bit what happens on market. Well, one more thing. If I wanted to quote off market here for my consumers here, I do have the start quote button up here. Takes you through the exact same process we just looked at, except you're the agent doing it instead of your consumer doing it. The screens don't change. There's a few language tweaks, but you are smart people, and I know you'll figure that out. If you want to go look on market, you want to bring your business there right away or shop this person there right away because they may be subsidy eligible. You do have access here in the left-hand navigation bar to the marketplace, and all you have to do is click Start Quote, and it'll open up a new window for you. And Renee, can you verify that you now see a different screen for me real quick?
Yes, I do, Randy.
Thank you. Because this is connected to the marketplace, it's an enhanced direct enrollment pathway. There is a setup process that you'll be prompted to go through as soon as you click on that Start Quote button. It asks you for your email, asks you to link it to your CMS account so they can verify that you are, in fact, FFM certified and can sell on the marketplace. But it's a fairly painless process. As I look around this call, some of you have already completed that process and probably can attest to that here as well. Once you've gone ahead and signed up and connected your CMS account, you're brought to a dashboard that looks like this. I want to give you a quick tour of that and finish puberty, I guess, before we get started here. So this dashboard button will always bring you here. If you're in the platform and you need help, you can always call us. That's your individual team number up here. And you have the opportunity to manage your account with a few settings and to log out of the platform. You'll see here that your NPN is there, so you can make sure you're the right person. That is a dummy NPN. It's not my actual NPN, because that would probably make me older than time itself. But the NPNs are there. And also we should mention, if you know your consumers are interested in marketplace coverage, you do have a custom link available to you here as well. All you need to do is copy and paste and send them off. I should mention right up front, though, that this is the staging environment. This is our testing environment. So there are a few things I won't be able to show you here today, but we'll get through the most of what you need to do to have a successful OEP here going forward. You see the context that you have in the quoting phase. You see context you have where the application is started but not finished, and you see everything that's gone active for you here, so you can quickly filter through that. You can also filter who you're quoting and clients here as well. I don't have any sold business here in this demo account, so I don't have anything over there, and have the opportunity to filter there. I can search clients by name. If I do work in multiple states, remember this is a marketplace platform, I can filter that here as well. I can look at both filter by on exchange here as well, and whether they're eligibility submitted, application progress, or some other stage of the process. You'll only see filters for what your clients are actually doing. Down here, when I come to manage my business or want to look at them, I'll always see their contact information here. I'll see the plan they're enrolled in, their premium, and any subsidy that they were eligible for, when the application was last updated, the status of the application, and I can either resume that. Remember, this is an E2E pathway, so you as the agent are empowered to act on your consumer's behalf in this case. It's not like healthcare.gov where they have to be the one at the keyboard. And you can either view that client or resume the application. But I don't want you to resume an application because we don't have a client yet. So let's see what it's like to start a quote and see some of the power here of shopping the entire marketplace inside Coverage for One. So we're going to look, start with any quote here does with the zip code. We'll use Wixom, Michigan here, shop for plan year 2024. And I'll note that there are 114 plans available in Oakland County. So your clients know right away that there's a lot of decisions to be made here. You do have the option for child-only coverage. If not, you can go ahead and put in the date of birth. We'll use the same scenario here, non-tobacco user, not enrolled in Medicare here. You can add spouses or dependents just the same way. And you'll also notice that, especially as they get down here to income estimates, there are links over here that tell people exactly what goes into their MAGI here when they're making that income estimate. You can choose the people on the tax return here. We can add a variety of income sources here. Let's say, for example, that this person is earning $35,000 per year or whatever the case might be. We'll add that to their calculation here. I can add additional income or deductions and then calculate the subsidy. So when I calculate that subsidy, I do get an estimate for the tax credit, $213.81 per month in this case. And based on this income, I might also be eligible for CSRs, which provide extra plans on those extra savings on those silver plans. So that's something to look at. If they forgot something with income or need to update that later, you do have the option to recalculate your subsidies here as well. Here, though, is where you have a choice to make. You can go straight to plan results and just shop the whole marketplace all willy-nilly, or you can continue adding health information and get some personalized recommendations based on the formulary and based on the doctors that you're in any health conditions your subscriber or dependents might be facing. So I want to show you how the software does that match with you there. So first things first is, does this applicant have a preferred doctor? And we're going to check across the marketplace to see whether the doctor's in network with those plans. So let's say, for example, there's not a ton of doctors in Wixom, so maybe this person travels to Farmington Hills and sees Sandra Saab. She's a family medicine doctor there. So I just started typing her name. I can go ahead and select that doctor and work from there. I can also have a variety of specialties, right? Not just PCPs. If I wanted to add the optometrist, wanted to add a pulmonologist or a cardiologist, I'm able to do that here as well. I also want to ask you about prescription drugs. So maybe this person does take some drugs. Maybe this person is on albuterol and they use that as a nebulization solution, right, to help control or fast-acting asthma symptoms here. You can choose the symptoms, rather. Choose the dosage, choose the refill frequency, and choose who that drug is taken by and add that to the roster. So now, of course, I have a doctor, I have drugs, and I'm going to ask about health conditions as well, because different plans have benefits built in to attend to some of those chronic conditions in a variety of ways. So this person here is asthmatic, and maybe they have depression and ADHD as well. So we can kind of juggle and see how that plan recommendation comes out. So I can add those conditions. And now, as I go forward here, I can see the plan results based on what's going on here. Renee, I've been talking for a little bit here. Anything to add about this application process or this quoting process before we move forward?
The only thing to add is it seems like it might be very helpful if the member does take a lot of medications, especially with different dosages and all that, to have them bring as much information to that meeting as possible in case they want to, search that way and to confirm all that information. That's very helpful, especially too with the names of any doctors that they see, because some, members do see quite a few physicians, and it might be helpful just to have all that information to get the most out of your appointment meeting with your client.
Yeah. Yeah, nothing worse than like the surprise specialist that comes in January, right? That you didn't know about and didn't check doctors because they didn't tell you about it, right? So always a good idea to prompt them to ask about every doctor you've seen and every drug you could possibly be taking. So you can give them the best match for their health needs. Here on the Shop and Compare screen, I know I'm shopping for plan year 2024. I have the zip code. If I need to edit any information up here, the handy dandy pencil button will bring me back a screen and let me do that. I can filter here by deductible range, by network type, so EPO, HMO, PPO, filter by carrier, and filter by tier. So there was a question earlier about what carriers will be shown to your clients. When you are looking at an off-marketplace enrollment through Coverage for One, so the sequence we looked at it just a bit ago, that it will only show you carriers you're appointed with. But this is the marketplace, essentially. It's just like healthcare.gov with a different wrapper and get a few more tools for you. But because it is the marketplace, CMS says it has to show your clients everything that's available on the marketplace. So it will show your clients plans that you may not be appointed with. So want you to keep that in mind if you're giving this link out for your clients to shop on market here. Say, though, maybe I'm only appointed with Blue Cross Blue Shield and Priority Health, the under 65 space, and that's who I'm certified with. If I filter down to them, I can scroll down and see a little bit more about these plans. So right away, I see that there's a plan identified that has the lowest premium for me, so that could be a good fit for us. I'll see health and drug deductible totals, out-of-pocket max, and the tier that we're looking for, as well as the plan type. If I were to view more here, I'd get a little more cost breakdown about how drug coverage, doctor visits, and urgent care looks like, as well as direct links to the SBC formulary and doctor list here as well, which is cool, but it's not everything the platform can do. We'll get there in just a moment. Maybe I want to compare this local HMO Bronze Secure against that same narrow network plan that we looked at off market, the Value Bronze Southeast Michigan network here. And you can see these plans here pop up here down the comparison dialog. When I go ahead and click compare, I get these plans put side by side with a filter to look at pre-deductible coverage and post-deductible coverage. So looking at pre-deductible coverage here first, I can go ahead and look down and see that, for example, on this plan with the Blue Cross local HMO Bronze Secure, there is no coverage before deductible for primary care visits. But on this Priority Health plan, the Value Bronze Southeast Michigan, there is a $35 copay for primary care before deductible. If I switch over to that post-deductible filter, again, the logic updates there to show me exactly what my clients would pay in either case. If I want to put these quotes in their hand, I can simply print and it'll generate a PDF for you here that you can either email or hand a paper copy off to your clients here as well. Amy, that is an excellent question, and you have the right of it. It's kind of like sending your clients off to healthcare.gov. If your client is doing the shopping on Marketplace, there is a chance they could enroll someone that you're not appointed with, and you're right, you wouldn't earn commissions there. So if you're going on Marketplace, or if your client is going on Marketplace, I would always suggest that you sit down with them and have an opportunity to sort of control the narrative a little bit here. Filter down and present plans that you are appointed with to help protect your income going forward with the client as you're going forward. Great call out there, Amy. So let's go ahead and talk. If I were to stay here in the comparison dialog, I could start the enrollment process directly here, or I can enroll right here from these paths here as well. Should mention we can also sort plans by lowest premium, deductible, or recommendation based again upon that health information we put in a bit earlier. Let's say, for example, they liked that before deductible coverage on the Priority Health Value Bronze, and that's where they want to enroll, even though they're not getting, they're spending a little bit more on premium here. Let's see what that enrollment process looks like. You're going to be asked to save this lead. We'll call this person December lead the 4th, because I already had December lead 3rd in there. We'll use my email address and phone number here again before we continue. And now that I have this information, I can go ahead and come back to this client at any time. So you're going to be asked to confirm some information here about subsidies, that they do want this plan here, and then be off to the races to continue and enroll. And again, this dialog looks a lot like the Marketplace application. It's either what you would see or your client would see, either way, as they were to enroll in coverage here. So they're off to enroll here. Here is where you would do the person search. And there's going to be a few reminders here about those new attestations, right? So you've confirmed their identity here. You've received permission from that consumer, and you've documented consent from that consumer to act on their behalf. If you need help documenting your forms, this consent. There is some literature for you available in Knowledge Owl. Also, when you log into Coverage for One, this notifications pane, you will see some links to some documentation for consent forms as you're working on the marketplace. So lots of different ways you can go ahead and comply with that here as well. I'll choose my coverage year here to go forward, and I'm ready to go on with my application. So I'm going to do my person search, and because I made up a person, I won't find an application here. So I'm going to be asked then to start a new application here. And this process should look pretty familiar to a lot of you. Applying in Michigan for coverage year 2024. Again, they are submitting the attestations here. These attestations do not satisfy the CMS requirement. Again, you need that kind of physical copy that you can go back to, or some kind of documentation you can go back to for that CMS documentation. So be sure you are talking with your account manager or looking at insurability for that here going forward. And actually, this is December lead, not me. So we will use that information and continue. So all the information we've pre-filled will carry over here into the application. They're applying for health coverage. You do and need to enter their social security number here as well. Here in the demo environment, I'm going to say they don't have a social because frankly, it makes things work a little bit easier here in the demo environment. But of course, we want you into the social there as well. You're going to be asked ethnicity information, their race, sex assigned at birth. So in this case, they were a male. Gender identity here is optional here as well. All those questions that they don't need are marked optional. Orientation, we can go ahead and click continue. You'll enter contact information and where they want to be contacted at. So whether that's email, preferred language here, spoken language, moving forward. They'll ask about their home address, and we'll use Action Benefits address here as well. Mailing address, and mailing address in this case is the same as permanent address, so we'll continue. We know that December here is applying for coverage. We can either choose to look for subsidies or choose not to look for subsidies. Here in the demo environment, it's not connected fully to the marketplace to check for subsidies here. So in this case, I'm going to say no, but only because I'm in the demo environment. For you in real life, when you're going to apply for clients, I will check for your subsidies here. So I'll save and continue going forward. We've got everyone here on the application, and we are moving forward. So December lead is a U.S. citizen. They are not naturalized or derived, and they are not incarcerated or jailed. We're kind of going forward here through some more of these questions here. They do have the opportunity to put in your NPN. Now, I should point out that if your consumer is applying here via the link you've given them earlier on, the application is automatically matched up with your NPN. You get credit for that. If not, it may ask you to put in your NPN here as well. So you would choose that you're an agent broker and put in their information here as well. So if I had there, I put in my agent's information here and put in that NPN and move forward. It might not have that connection in Nipper here, actually here in the demo environment to verify that. So in this case, we'll actually say we're not assisted here, but in real life, again, it does have that connection. We're asking about SEPs here. So these people are not eligible for SEPs because they're using open enrollment. They're not receiving an offer of an HRA. They have no other SEPs here. And here I'm off to the application summary where I can see everything. I can verify all this marketplace application. Remember, this is that second part of the new compliance requirements this year, that the consumer has to verify everything they've put in here is true. Everything that you've put in here is true. So this is a good, careful review opportunity. And you're again attesting that they've confirmed the accuracy of that documentation and moving forward. They're also talking about your eligibility attestations, and there's additional attestations here as well. Again, giving permission to the marketplace to either continue or end coverage based on what, if someone does become eligible for Medicaid here. And then they're off to sign their application. So I'm going to decide it here as December lead the 4th and sign and submit. So it will do some thinking here in the background. Renee, anything to add about the application before we, while we're waiting for the computer here to work?
Not at this time, Randy. Everything looks good, and I think you're doing a great job.
Thank you. So you from here, you get an eligibility determination right away. This person is marketplace eligible, but they must enroll before January 16th. Remember, OEP is extended by 1 day this year because of the federal holiday. But it does also say that there will be some documentation required. So this person, because they don't have a Social Security number, will need to submit other proof of citizenship by St. Patrick's Day of next year. You'll also see a few things pop up in my screen here. Those are email notifications. So CoverageForOne is emailing both the agent and the consumer, letting them know that they have some things to do, and also giving them an eligibility determination here right away as well. So I've just got 4 emails, no less than 4 emails, because I have both the agent and the consumer emails coming to me here at the moment. So we'll click continue. You can download the subsidy information up here, the eligibility results notice up here. So your consumer, and you have that. I can then go ahead and confirm I can enroll in this plan. And this is where the process stops because it does not actually complete enrollment for us in this priority health plan. But all they have to do is agree and put in their name, and then they're off to the races. They've enrolled. And that is where they would need to go. So I'm going to save and close this application. I should point out that as I click save and close, you can either continue with this application, or if you do save it, you can come back and visit December lead 4th or your client here later on and resume from exactly where you left off last time, especially if your clients are off collecting documentation to help support their application, as the case might be. Now, here's the beautiful thing. You can't see it here yet because I don't have any business sold here in the demo account. But if I had someone that was in plan year 2023 and they're moving into their 2024 coverage, I get different options here to help them manage or update their application. So if they need to work with you to update their income because they've either gained or lost coverage, or they have an SEP, or maybe they've moved, you do get more options here to manage their marketplace application on their behalf. And remember, because this is an EDE pathway, you have that power here, which you don't have on healthcare.gov. So all that said, we've spent 45 minutes learning the ins and outs of applying for off-marketplace and on-marketplace coverage via CoverageForOne, showing you all the flexibility the tool has to offer here today. Renee, want to see if there's anything you need to add before we send our folks on their ways here today.
The only thing I would like to add is if an agent runs into any technical issues and for some reason the system, something is not working for them, or they're stuck in a certain area, you can always take a screenshot of where you're at, and we can share that with IT, and they can take a look and see what's going on, and then we can get that resolved for you. But please don't hesitate. Reach out to your account manager. We are happy to help you and answer any questions you might have, and help get anything resolved for you.
Yeah, great point. We are here to help with the platform. It's our platform. Don't want you twisted in the wind, so want to make sure you're successful here with it. I did see a question come in from Stacy. Hi, Stacy. Stacy, you're asking, are you able to upload required information like citizenship or proof of income? Will it go directly to the marketplace and satisfy those requirements? And the answer is yes. So if I were to have information in back where I had that proof of citizenship question, I did have the opportunity to upload documentation there as well. Yep, this is as good as healthcare.gov for submitting those sorts of things as you update the application there. It just gives you, as the agent, the power to do that because it's an e-pathway. It doesn't make the consumer do it. Now, I should mention, and we don't have time here to show it here today, that when your consumer is enrolled via your custom link, or they quote via the custom link, that is as good as them creating their own healthcare.gov account as well. So they could go in and upload information. They could go in and submit their binder payment for first month premium, right? Or manage their premium. I will note that just like any other platform, you can't set up ongoing EFTs through Coverage for One, but you can help your clients submit that binder payment for that first month here. Speaking of binder payments, see Amy is asking about, I've enrolled a few people, says action needed for them to make their payment. Even after I upload their payment, still shows action needed. Stacy, that's a great opportunity for you to either hop on with your account manager or to send us a screenshot. There could be a few different things there. It might be, as we just talked about, that they're still missing some supporting documentation with an application. So whether it's, whether it's a QLE or whatever the case might be, that's part of it. It's probably a case-by-case basis on why it might say action needed in that case. Your account manager is happy to help troubleshoot that with you.
Randy, I can add that Find a Doctor tool that you show. We received a lot of questions during AEP about looking for a doctor or so. So that's a great tool within the system to have where an agent can help a member verify a provider.
Yep. And we should mention again, I neglected it earlier when I was going through that plan comparison. But when I was on that plan comparison screen, when I'm putting that blue plan against this My Priority Value Bronze, it does show you up at the top of the plan comparison whether those doctors are in network and whether and how those drugs are covered that you've put in there as well. My mistake, but happy to walk you through that, or your account manager can walk you through that as well as you get into working with the tool. All that say, ladies and gents, Renee and I are happy to stick around for any other questions you might have about Coverage for One or anything else under the sun. But that concludes our demonstration here today. I want to thank you all for your time and attention here today. If you need help getting started with Coverage for One or need your invitation email again, please reach out to us. We're happy to help you with that as well. Otherwise, good luck and good selling the rest of this OEP, and thank you for spending time with us here this morning. Always love seeing you all here today. Renee, anything else to add before we close out?
Not at this time.
All right, then, ladies and gentlemen, on behalf of Action Benefits and my obnoxiously loud sweater, I wish you all a good day. And if I don't see you again before the holidays, please enjoy your holiday season. Thank you. Have a good day.